Developed after 40 years of research and exclusively for LifeVantage, Protandim is a true scientific breakthrough in anti-aging. Protandim has been reported on ABC, NBC, and PBS, featured in the Wall Street Journal, and described in CNN Chief Medical Correspondent Dr. Sanjay Gupta's book, Chasing Life: The Quest for Immortality. Protandim's creator, Dr. Joe McCord, is a world-renowned scientist and a pioneer in free radical biology. Dr. McCord is the discoverer of the key anti-aging enzyme superoxide dismutase. His role in the discovery is so significant, the enzyme is measured in McCord units.
So it's very exciting, and it's really quite an honor at this time to be working with a doctor like Dr. McCord. You know, the information that he has put out is published in some of the most well-respected, scrutinized, peer-reviewed literature, like, for example, Free Radical Biology and Medicine, an incredibly powerful journal. But these articles and these studies that he has published really make it clear that this is very, very powerful chemistry.
For Dr. McCord's discovery of superoxide dismutase and his contributions in free radical biology, he was awarded the Elliott-Cresson Medal. This medal is awarded to distinguished inventors and scientists, putting Dr. McCord in the same company as Pierre and Marie Curie, Alexander Graham Bell, Orville Wright, and Henry Ford.
And as I was looking at the results of this hit, I noticed one paper that really changed an important way that I have viewed Protandim vis-a-vis cancer. And I discussed this with a number of you this morning, and this is a big topic, Protandim and cancer patients. And this paper looks at not Protandim, but curcumin, one of our ingredients. And curcumin in and of itself is a NRF2 activator. Protandim is greatly amplified. It works better than curcumin because we've got the synergy of the 5, but the mechanism is the same. Curcumin activates NRF2, Protandim activates NRF2 more strongly. And just look at the title of this paper, and I think this can speak to you. It's a little obtuse maybe, but you can look at that title and figure it out. Curcumin, the golden spice from Indian saffron, the researcher here is Dr. Agarwal from India, and he has a particular affinity, I think, for Ayurvedic medicine, for traditional medicine from India. He's at Baylor Medical Center in Houston, Texas, well known in the field of NRF2 activators. So curcumin is a chemosensitizer and radiosensitizer for tumors. What does that mean? Tumors are treated with chemotherapy and with radiation. The reason for treating tumors with those two treatments, and they both increase oxidative stress substantially, is that unlike most other therapies that you get from the doctor that tend to make your cells work better, these two are designed to kill cells, because your body, if you have cancer, contains cells that are rogue cells. They're out of control. They're multiplying, trying to overtake your body. And a concern has been, because chemotherapy and radiotherapy both increase oxidative stress in an attempt to kill cancer cells, there's been a controversy for a number of years. Is antioxidant therapy a good idea here? Because you may actually protect the cells that you want to kill. You're using a therapy to put focused oxidative stress on these cells with the idea of pushing them over the edge, killing them. And therefore, I have recommended to everyone who's asked me for the last 5 years, should I take Protandim if I've got a cancer diagnosis, I'm about to undergo chemotherapy or radiation therapy? And my conservative response has been, because this is controversial, some scientists argue, don't do it because you may protect the cancer. Others have said, do it because you may protect the other tissues more than you protect the cancer. We didn't really have a definitive answer. This paper says activating NRF2 actually sensitizes the tumors to radiation and to chemo. So it's going to have a bigger effect. Okay? And the other part of that title is just as important. NRF2 activators are chemoprotectors and radioprotectors for normal organs. So imposing a NRF2 activator changes the way that tumors and normal tissues respond to radiation, and it does it in the best possible way. It makes the radiation more effective at eliminating the tumor and less effective at causing damage to the rest of your body that really needs to survive. Right. So again, what's my point here? This is a changing scenario. Every week, I do these searches myself. I look at the most recent new papers that have just hit the press, and this is the kind of thing I learn. And it changes the way I view Protandim. I said what I say today about it is very different from what I said 4 or 5 years ago, and this is precisely the reason. We're in the middle of a rapidly changing field, and we need to stay tuned to this company and to sites such as PubMed.gov to get the latest information.
Does Protandim interfere with any prescription drugs? Just like prescription drugs, the ingredients in many supplements are metabolized in the liver and excreted by the kidneys in the urine. The ingredients in Protandim, however, are primarily metabolized and excreted by the liver into the bile. This difference decreases the likelihood of Protandim interacting with other over-the-counter products or with prescription drugs. In fact, after years of public availability and use, we know of no significant drug interaction with Protandim. Can people take Protandim while taking Coumadin or other blood thinners? Yes, people on Coumadin can take Protandim without interference. If they test their own clotting time, they should test a day or two after starting Protandim to make sure they don't need an adjustment in Coumadin dosage. Also, as always, if there is a question, consult your doctor. Can people take Protandim while taking Plavix? Yes. There is no known problem for Plavix users taking Protandim. How does Protandim work for skin cancer? In summary, tumor promoter TPA incites cutaneous proliferation and inflammation mediated at least in part by oxidative stress. Protandim prevents skin tumor formation via the induction of several primary antioxidant enzymes. As the induction of antioxidant enzymes is a much more potent approach than the supplementation with conventional stoichiometric antioxidants, Protandim may be suitable for translational research and may serve as a therapeutic approach for cancer prevention. How does Protandim work for chemo prevention? MNSOD is a highly inducible protein, and when induced by dietary compounds such as Protandim, is effective in the suppression of tumor promotion. The results of a peer-reviewed scientific study further confirmed and extended our previous findings that Protandim modulates tumorigenesis via the induction of endogenous antioxidant enzymes. In addition, Protandim utilizes multiple mechanisms to modulate cell proliferation and apoptosis in vivo and in vitro, which both contribute to tumorigenesis. Furthermore, these results further demonstrate the effectiveness of multimodal antioxidant-based therapies in chemo prevention.